In this video, we're going to discuss iatrogenics, which is a medical trauma. If you're new to my channel, my name is Dr. Erica Steele. I am a board-certified naturopathic doctor. I hold 6 degrees in my field, all in the natural healthcare space, and then I have a 7th degree, one in business. So welcome to my channel. I like to say I went to school, so you don't have to. And today we're talking all about iatrogenics, which is medical trauma. So let's jump in, right? So conventional medicine, even though, we talk a lot about superiority bias and unconscious bias and implicit bias on our channel. And so we fail to recognize that conventional medicine, even though it's considered, superior, the gold standard, all the things, it has imposed an incredible amount of harm onto people. And so, in fact, it's the third leading cause of death in the United States is medical errors, specifically from pharmaceuticals and pharmaceutical interactions. And so I really wanted to talk about it because so many people experience iatrogenics, which is medical trauma, and are not even aware that there's a name for it or even that they've experienced it. So I very naively, started my practice. I wanted to stay within my cultural views. I wanted to keep a very natural practice that was very important to me. I wanted everything to be natural, and so I created that. And slowly, quickly, I realized that people were fleeing the conventional medical model. They were leaving it really rapidly and really searching for natural solutions. They had low education in natural solutions, naturally not as much access because there's just not enough holistic providers around. So my practice opened up in 2009 in Virginia, and it was just like boom. I mean, by 2010 my doors were like blowing off just because of the need and the lack in the particular area. So I saw lots and lots of people and heard lots of stories about how their symptoms were dismissed or they were turned away, or that they had reactions and were medically gaslit and not explained all of the different options, or rushed into treatment, or what's worse, we'll talk about later, coercive control in healthcare. And so we really see the medical trauma that this creates. So I like to kind of look at it as like a dual trauma. So first thing is institutional trauma. So we put a lot of our faith in these institutions, CDC, NIH, hospital systems. We rest our faith in healthcare solely on their shoulders. And so then we deal with betrayal trauma because we're beginning to learn that these systems that were built are not there to serve us, and or they have their own agenda and their own biases. So now we're trying to seek care. The system is trying to keep us sick, and we're just butting heads. And so what happens is then I have to leave the healthcare system, which was designed, as I thought, to help me. Now I'm going to go into general population, YouTube videos, authors. I'm going to go down all of these rabbit holes, trying to be my own researcher and my own advocate and my own doctor because I'm not feeling well. I'm not getting the help and the support that I need. I'm feeling betrayed over and over and over again. And this is where this mindset of medical trauma really comes in, because now you're feverishly looking for a clue, you're looking for the answer. And so what happens is eventually people realize how complex the body is and how they can't just DIY it. So then they come to doctors like myself with that same kind of DIY mindset, and I have to slow them down and build them into a new healthcare system, and so and educate them from the ground up. But even after years and years of working with patients and getting results, the medical trauma and iatrogenics still shows up in questioning, doubting, afraid. Am I supposed to do this? The quick fix kind of still thinking, running in and out of the ER with every, pain, sprain, etc. So all of that are all symptoms of, iatrogenics medical trauma, and so we don't see it, and it affects the trust of the relationship and the trust of provider, simply because the providers have failed. They did not provide the care that they needed, and were not transparent and honest with the patient that they didn't have the answers, which that gets into our informed consent. So if you as the provider don't have the answers, right, it's part of your job to actually search for some answers, search for clues, and many providers have, and what they find is it's more natural based, and so then that leads them down kind of a self-awakening path, or they get ill on their own, or their family member gets ill, and that sends them down this path of holistic health and natural health. The problem is, which this isn't the topic of this video, is that then they try to come into our profession and pretend like they know and take over and all that, but that's a whole nother profession, a whole nother topic. So informed consent is, the doctor really being honest about, this is what I see based off of my training and my training alone. I'm not the gospel, I'm not God, I don't know everything, but this is from my lens. And then here are some possible treatment options without bias, think about it if you want, here you can schedule this procedure this time, or here's this prescription, but it's no pressure. It's literally, I'm evaluating, I'm giving you all of the options, and even ones I don't, necessarily give, like I will even look at conventional options and recommend that to patients so that they're getting a well-rounded assessment so that they can make an informed decision. It's not just about only giving them, natural holistic options and then telling them, hey, all of the rest of these you can't. That doesn't work. We want to be integrative. We want to think outside of the box, and we want to give them options so that they can make an informed decision for themselves, right? And so when they're not getting that again causes trauma, because, oh, I wish somebody had told me. Oh, I wish I knew. And again, we have this superiority bias, thinking that the medical doctors know everything, and they don't. You can't possibly know everything in healthcare. We're trained in a certain area of specialization, a certain philosophy, and we really need to stick with what we're trained in and what we learn. That's scope of practice. So again, iatrogenics, it shows up commonly with people. It can show up like anxieties. So if you're the type of person that every time you go to the doctor and you get your blood pressure reading, it's always elevated, probably iatrogenics. Obviously, white coat syndrome is a thing. If you are constantly, obsessing about your health, I see this a lot with people with parasites, because, conventional doctors just do not recognize them. And so they're having these symptoms, and by the time they get to me, they're like full blown into not only physical manifestations, but again, this medical trauma that you literally almost cannot convince them to do any treatment. They want to constantly do these cleanses, and it's very dangerous to the body. So, again, it happens all over. Or they've been to a holistic doctor or natural doctor, and they've been given a whole bunch of things that, that really didn't help. That's another form of, again, that betrayal trauma, institutional trauma. Makes sense? So coercive control, and I think I left off an H there, but coercive control is something that I've been seeing more and more of, and something that I definitely want to speak to, because it happens, and it may be happening to you or some of you know. So let's say you go into your conventional doctor's office. It's probably the easiest to illustrate this if you are a parent. So let's say you're a parent and you have a child who is not well, and you go into the conventional doctor's office, and the conventional doctor makes a recommendation. And let's say that recommendation you're not comfortable with, you need to think about, because these are your children. And I think providers don't, there's a real disconnect in empathy and humanity, where they don't understand that, if you have a certain, health concern, especially for your child, right? We're making decisions for our children. So if we encounter our children, and we're responsible for, pretty much everything with them, especially as parents, like mothers, oh my gosh. And so we're given all of this information. We want to make sure we make the best decision possible. We want to do our own research. We want to talk with other people, our support system, we want to go to our counsel, and we should be able to do that as parents, as just regular healthcare consumers. But unfortunately, what happens is this coercive control, where there is a lot of conversations that are said that are really out of line medically, and that are really just said, again, to pressure you. So things like this, well, if you don't do this, this will happen. Or, are you sure about this? And you really need to make a decision now. And, if you don't make a decision, I'm going to do this. I'm going to call these people. I'm going to make this happen. I can't tell you how many people who have come to me because they've been threatened with CPS because they had a question, or they wanted a second opinion, or they had gone through the treatment previously and it didn't work, and they wanted to send the patient through another round. There's lots of different nuances of this, but the bottom line is we're leaving the world of informed consent, and now it's bullying. It's if you don't do this, or else. So from what I remember, the healthcare system is not like the legal system. It's not the criminal justice system, but there's a lot of bleed over, I notice. And the medical world will use their bias and use their, their power and their control to wield against patients, and that has to stop. Patients need to have a safe space to come to, where they can be inquisitive, where they can ask questions, where they don't have to excuse me, make a decision in your time frame. These are major decisions that a lot of times patients are making, and they deserve just 5 minutes to take a breath, even for their nervous system to catch up. And that's where healthcare has lost their humanity, and almost seems like an assembly line of quotas. And if you step out of line, they will try to get you back in. And it's become not a healthcare system, but a very dogmatic, very unsafe system, which is why many Black and brown people just avoid the healthcare system, because they don't want to be criminalized for not agreeing. Most Black and brown people, they come from lineages where their families pass things down. Take this herb, take that, drink, take that food, whatever. And so they still have connection to that. And you're asking them to abandon all of that erasure, right? Colonization, and then surrender to this heavily medicalized, heavily corrupt system that still uses Black bodies to this day illegally against the Nuremberg Code for experimentation, and gets away with it. So, the trust is not trusting. And so I think for good reason, coercive control is a thing. If you are experiencing coercive control in healthcare, know that that's illegal. Please get all of the healthcare providers' information, their name, their license numbers, etc. Take lots of documentation, record if you can, and for your own rights, really, you should be able to record your appointments. Any patient of mine can record any appointment that I have. Most of my appointments are already pre-recorded because I don't want any abuse and shenanigans, So, I mean, really, it's for protection, because what lives in the dark stays in the dark, which is why I'm bringing these things to light, because I've seen them for years and years and years. And so, as when patients come to me, I empower them with decision making. This is about choice, but it's also not just about being another savior. Like, a lot of times people come to me in very traumatizing situations, very difficult situations, and we want to work with people step by step. But it's not like I'm not a quick fix, magic pill, magic wand, or I'm not going to do everything you want me to do. If you come to me in a crisis situation, I'm going to do it the proper way, step by step by step. I'm not going to do it based off of manipulation. And that's the integrity to the care that has to really be in place. Otherwise, there's no integrity to care. Otherwise, you're not going to create a result, and inevitably you can harm people. So lastly, let's look at the research, because really when we come with patient empowerment, it's all about education. It's all about motivation. It's all about inspiration, but it's really the patient's willingness. And sometimes patients need a little bit of extra support to be willing. So let's look at what the research has to say when it comes to Iatrogenics. So Macri and Daniel in 2016 estimated that medical errors are the third leading cause of death in the US, accounting for over 250,000 deaths annually. So safe and effective, questionable. Coercive control in healthcare. So a study by Frosch et al. 2012 showed that patients often felt pressured into treatments, with doctors not fully explaining alternative options and compromising the principles of informed consent. So this coercive control is something that's researched, something that's studied. So it's not something that's just off the top of my head. It's definitely something that I've seen in practice, and then it drove me to study and research and try to understand what is this phenomenon that's happening. And then lastly, informed consent and patient empowerment. Mazur et al. 2004 found that transparency from doctors about uncertainty, right? So if I'm a doctor and I don't know, if I say that I don't know, instead of gaslighting you or dismissing you or pretending I don't know, if I say, you know what, I don't know, but let me do some research, let's see you back in 2 months, 3 months, whatever, that's a different conversation. That actually was shown in this particular study to strengthen the trust, and contrary to the belief that the doctors must appear certain. So in the indoctrination and training of conventional doctors, it's kind of perceived that the conventional doctor must be all-knowing. They must, get everything figured out, know all the things, and if they don't, they're inferior, which couldn't be far from the truth. You can't know everything as a doctor. That's why we have specializations. If you're not trained in nutrition, don't answer nutrition questions. Refer them either to a nutritionist or a doctor like me. If they're asking about supplements and you don't know about supplements, you're not trained in them, don't try to, I can't tell you how many doctors will go get this supplement and not tell the patient what supplement, what the dosing is, what the companies they need to look for, what they need to stay away from, because it's a big business. So you're sending people out into a sea of supplement world. And again, they come to me, they end up with me, and they're like, oh, my doctor said to take this. And then I look at it and it's junk. The dosing's not even comparable. It's toxic. So really, if you're gonna prescribe supplements as a part of your conventional treatment, do some education on it, learn so you know what you're actually talking about. Otherwise, just tell patients you don't know and leave it there, because you're causing more harm by not knowing and giving bad information, right? So not everyone needs to be on vitamin D3, God forbid, right? It's not just because of the sun, it's a liver issue. So there's a lot more to it than what conventional doctors are trained in. Unfortunately, because the way our system is set up with superiority bias, unconscious bias, and implicit bias, it is creating tons of trauma or medical trauma, iatrogenics, which is also coupled with institutionalized trauma, betrayal trauma, right? And so patients are now at the effect of that, and providers like me are the cleanup crew of that. I think this is a lot of why I became a holistic doctor, because I can't just subdivide. If you are a human standing in front of me, I can only see all of your humanity. I can't say, okay, this part of your humanity goes to that person, this part of your humanity goes to that person, this part, I just can't do it. So we also have to get out of this dehumanizing view in healthcare, because it's really harming us. So anywho, if you like my content and you enjoy these conversations, critical psychology lens, looking at the healthcare system, I don't always talk about that, but I do talk about other things like food and water and foundational health things and detoxification. And if you have a topic you want me to talk about, please let me know. And of course, share, subscribe, and comment for more.